Okay, welcome to the ADAA webinar, how to help your child feel less anxious, more capable, and stronger. I'm Katharina Mokru. I'm an assistant professor of behavioral sciences, York College, the City University of New York. I'm also a licensed clinical psychologist in the state of New York and the director of the Stress Less at York Research Program. My areas of specialization include cognitive behavioral therapy, dialectical behavior therapy, and mindfulness-informed approaches. In addition to working with adolescents and adults with anxiety, depression, I am also a Thai-speaking mental health provider, so I do provide services to the Thai community in the tri-state area. And I'm a member of the ADAA Public Education Committee. Now, we'll be able to answer some of your questions at the end of the presentation. On the right side of your screen, you should see a Q&A panel. There's a little field at the bottom of that panel, and when you click in it, you can type in a question, then either hit enter or the icon. You can ask the questions at any time, and we'll try to get to as many as possible. Other participants cannot see your questions. Now, we may not have time to get to your individual questions, so we apologize if that is the case. We'll also be recording this webinar to make it available on the ADAA website at a later date. We are broadcasting, so we cannot control your individual audio or visual computer setting. Today we'll be hearing from Dr. Lynne Siqueland. Dr. Siqueland is a psychologist at the Children's and Adult Center for OCD and Anxiety in Plymouth Meeting, Pennsylvania. She has treated anxiety disorders in children and adolescents for more than 20 years. Dr. Siqueland enjoys providing training workshops for professionals and especially for parents, because her long-time research and clinical interest has been how parents can help children grow and thrive despite anxiety. Now, before we begin, I'd like to tell you about ADAA. It was started in 1979, and today it is the leading nonprofit dedicated to increasing awareness and education about anxiety disorders, depression, OCD, PTSD, and related illnesses. ADAA's mission is to improve diagnosis and promote the prevention, treatment, and cure of these disorders through education, practice, and research. ADAA fights to end stigma by promoting the message that they are real, serious, and treatable. Please visit the ADAA website. That's www.adaa.org, which includes Find a Therapist, a searchable database of treatment providers, as well as free educational information and resources, self-tests, self-help groups, clinical trials, and a lot more. You can support ADA's efforts such as this webinar series by making a charitable contribution on the ADAA website. Remember, you can type a question at any time. Now, let me turn it over to Dr. Siqueland.
Hello, welcome. Thank you so much for joining us tonight. This talk is geared for parents. Of course, professionals are welcome too. I'm a child psychologist, a clinical psychologist who specializes in CBT, cognitive behavioral, and family approaches for childhood anxiety. I have always enjoyed working with parents because over and over again we have found that many parents and kids and teens can, with some good information, do amazing things, sometimes on their own and sometimes with professional help. This presentation is not made to have parents feel bad or that they are doing something wrong. We as parents are always just trying to do the best we can, and we're human, so we handle some days well and some days not. So instead, what I'd like to do is to present some things that parents can do to help coach their kids through anxiety moments, and to highlight a bit some things that might make anxiety hang around. Now, you can't see me, but I talk very quickly. I'm going to try and be aware of that, but I also have a lot I'd like to cover. So you could also type in if it's way too fast, and I will try and modulate myself. I'm not going to spend a lot of time this evening going over anxiety disorder diagnoses, but I like to put up and talk to families about flavors of anxiety. It's my experience, as many other people have found, that lots of kids, and indeed lots of adults, don't fit neat categories. They may have a little bit of this and a little bit of that. And a lot of times kids especially might have a little bit of different symptoms across these different areas of difficulty. But let's just say that generalized anxiety is kids who, what we call the what-if children. And if you have a child who's a what-if child, you probably know what I'm talking about. You might get in the car and they might say, what if we get lost? What if you don't know where to go? What if we're late? It's a list of what-ifs. They worry about multiple areas, not just one. They can have headaches and stomach aches, and they can but don't always have high standards or perfectionism for themselves, and they tend to avoid things. All types of anxiety involve avoidance. In contrast, social anxiety is worrying about how others are viewing you or judging you, a sense of extreme self-consciousness, and not liking to be the focus of attention. Now, everybody knows that everyone thinks about this sometimes, and middle schoolers and high schoolers are going to think about it more, but these are kids who spend a lot of their day concerned about these issues, even when there's evidence that they're not having that actual experience. And what's very difficult for kids is that they worry before the interaction, maybe even a week before. They worry during the interaction how they're doing, and they might beat themselves up as well after the social interactions. So that's social anxiety. Finally, separation anxiety is the other main area for children, and it's often concern about being apart from the family or from home. There is often a concern that harm will come to the child or the family or the parent if they're apart. And these kids, especially younger children, will have a big concern about pickup or drop-off, and they'll have a hard time with goodbyes or transitions. And many people think of this as a young child difficulty, but there are many adolescents who do a subtler version of kind of calling home to connect with parents, check on parents, are concerned about being able to handle situations while away from parents. So that can be separation anxiety as well. One thing that doesn't fit a category is just kind of red flags for all kinds of anxiety. Avoidance is the biggest one, staying away from age-appropriate activities or refusing to try new things. All those what-ifs. Lots of reassurance seeking, which we're going to talk about later, kind of asking, is everything okay? Will I be okay? What's going to happen? And many of us know if we have a stress or worry, we can kind of talk through it with our kids, especially kids who don't have anxiety, and we can kind of work something out. But sometimes anxious kids, you can talk through and it doesn't lead to a resolution. There's physical complaints that I discussed. There's difficulties with sleep at times. The perfectionism. And a lot of these kids are really wonderful kids, but they have a really strong sense of right or wrong, a sense of a broad responsibility for others that is both one of the wonderful things about them, but also makes life a bit harder. So as I said, I'm not going to go into this too much, but anxiety is part of life. It happens to all of us, and sometimes it doesn't need to be treated at all. But we decide to treat it when it leads to extensive avoidance, when it's really out of proportion to the situation, if it persists for a long time. And lastly, one thing I'm going to talk about a lot tonight is, does the anxiety interfere with the child's functioning? Either they're in a lot of distress, and a lot of kids, come to me and say, I worry all the time, or I'm a stress mess. So they identify that they wish they worried less or were anxious less. It can interfere with academic functioning, but it's also really important if it interferes with family functioning, either parents' well-being, other siblings' well-being, the ability to try new things, to go on adventures, to be able to manage mornings without crying and distress and yelling. So it's really important that families take seriously how they're feeling, even if the kid says, I'm fine, if the parent is feeling, too stressed about kind of managing the day-to-day. So one thing that's important before we get to the parenting aspects is to understand a bit about the nature of anxiety. And I'm going to show you a little bit about how we talk to children directly about this. And for the professionals, these are the exact same things that I might say to parents in a meeting or in a session as well. So this is the language that we use. All anxiety involves a sense of feeling in danger or threat and looking out for danger or threat. And the most common aspect of all anxiety is an often overestimating that risk or that danger, along with underestimating one's ability to cope with that situation. For many, many people with anxiety, there's also a lot of difficulty tolerating and handling uncertainty. And there are attempts to control what feels out of control. Because there's often a belief that if things are out of control, I might be undone in some way. I might fall apart in some way. So some kids can look extremely controlling of the situation or their family, but they're actually not trying to boss people around. They're just trying to control the environment because it makes them feel like they're safer, and there's going to be a big problem if things are out of control. Probably the most important slide to gear parents to help kids with anxiety is this one. And I'm using some language that comes from my colleague's book, Tamar Chansky's Freeing Your Child from Anxiety. The main thing about anxiety is it's the emergency that isn't. So what I'd like to explain is that any adult in an anxious situation, and also children, feel like something bad is happening. They don't understand what's happening to them. They feel that this is 100% full-on emergency. Of course, there's low levels of anxiety and high levels of anxiety, but kind of each situation of anxiety feels like an emergency. That child, therefore, wants you to take away the emergency. If you're a parent, make this better, make this go away. So they want you to help you fix it, or they want to say, get me out of here, because those are the normal responses to a sense of danger or threat. But the thing to remember as a parent is you can't take away something that wasn't there in the first place. So an example is a child who maybe gets very anxious about every new situation, and they're going to go to the first meeting of a drama meeting, they're going to go to soccer for the first practice. They feel that first practice of soccer is a danger or a threat. But soccer is not a threat. There's anxiety that is coming up, but soccer isn't a threat. So removing or running away or not going to soccer is not going to address the anxiety. What maintains anxiety is that paradoxically, the things that kids try and do to just help themselves feel better, avoid things or ask a lot of questions, only makes things harder. And we're going to talk about that more later on. And paradoxically also, the thing that parents sometimes do and teachers sometimes do is to reassure or help too much. Some reassurance and help is great, but too much can lead kids to become dependent on that reassurance, and it validates that the fears make sense. So one very common thing for poor parents who have an anxious kid is they're not sleeping. Their kids are needing them to go to sleep next to them, or they're sleeping with the parent, or they're kind of needing an additional help. In some ways, if we, for a long period of time, months or years, stay with our child always to kind of be able until they're fully asleep, it suggests that we believe they need that to be able to go to sleep. That's one example. It's always clear that accommodations or changes or taking things step by step needs to happen, but we always want to have a plan for growth. So we're having special assistance in the short run as a child, say, is learning how to put themselves to sleep and how to soothe themselves at the end of the night, and we can't just rip that out and just say cry it out or leave. Of course we can't do that, but we probably don't want to settle in to holding their hand or sitting with them for months and months at a time. We might say we're taking the next 2 to 3 weeks to manage your sleep fear, and we're going to do it step by step. So there's a plan for growth, and we're saying we have an aim, to be able to do this by the end of the month, say, for example. Temperament is really important. There are kids that vary from being very social to reserved, from cautious to adventurous, and quiet to talkative. What we want to know is that temperament is important, but it is not destiny. But we need to work with how we're wired. So I'm going to talk quite a bit tonight about helping teach kids to know their temperament, to respect it, to honor what they know about themselves, like I don't like new things or change is hard for me, but we don't want them to be ruled by it. And lastly, depending on the child's temperament, we are living in a very fast-paced and high-demand world. And we want to choose how to participate and figure out what works for different kids. So some anxious kids tell me, I am best. I'm doing sports every day after school because I get structured, I get it out of me, I get my energy out, and then I can come and do work. Other kids say, I need days at home, I need time to myself, I need quiet, and they're usually right. So kind of matching temperament to the demands or expectations is important. So as I said, I want to set a brief foundation about what we know about anxiety and how it presents in children, because it's going to lead to how we suggest, how I suggest you work with your child in an anxious moment. So one thing that's very important is that anxiety and worry are just normal responses. And anxiety disorders can just be too much of a good thing. You have a sensitive alarm system, or it goes off too easily, or it goes off too broadly, and it's not your fault, right? It's just, in some ways, how you're wired or what you've learned. We talk about, which I'm not going to go into too much, a three-component model of anxiety, of understanding how does anxiety make your body feel, how does it make you think, and how does it make you act, and how is that different from when you're not anxious. And mostly we want to empower children to learn to take back control from worry and do what they want to do with their lives. So as I said, a lot of what we do is education and engagement about what anxiety is. There are some scripts in Dr. Chansky's book that have different ways to talk to children of different ages. There's a number of other really good resources that can help you with this if you're a parent trying to do it on your own. One of the most important things we do when we're beginning to help parents is to also begin to have them say to their child in moments of stress or anxiety, you're feeling scared right now, but you're not in danger. That simple phrase, without a lot of other phrases, can help the child know what's going on and what's happening, and to differentiate between feeling anxious or feeling stressed versus being in danger. We often have children give a name to their anxiety and draw a picture of it. I'm going to show you that in the next slides. We want to help children think about what you hate about your anxiety and what you would be doing instead if you were worrying less. What would your afternoon look like? What would you like to have time to do? What would you like to be pursuing? Pictures speak 1,000 words. This is a 11-year-old boy who he's a worrier, called his the guilt goblin. I am not covering OCD tonight because there's slightly different things that needed to be added to help coach a child through an OCD moment, though some of what you'll hear tonight should be helpful and relevant for OCD. But this is a young boy who had OCD, who really felt like the OCD monster above was making him dance like a puppet on a string, and he was crying in response. These kids are both doing really great, but they were not, this is what they drew when they first came to meetings. So what we're going to try and help children do is have a different kind of solution other than get me out of here or make this go away. We want to help them do something different with their thoughts and their reactions to the moment. So it's not the thought that's the problem, it's what you do with it. So if a child, again, is going back to that soccer practice, like what if I don't know anybody, or what if I can't do it, we want to help them just label that a bit. So you're having a scary thought, you're having a scary feeling. And we're going to work to help them change the label and the picture of what they're experiencing. And it's really important to have kids know, like I said, that it's not their fault, that their first reaction to a situation is often fast and they can't help it. It comes right up. It's kind of how they're wired, but it's often not accurate. So I'm a bit goofy in my sessions, but I've found over time that I can say to either a 5-year-old, or even a 16-year-old, most people have 2 different possible reactions to an anxious situation. Oh, no, which means I can't handle this, oh my goodness, or no, I'm not going. And a lot of kids who are anxious present to their parents with one of those 2. The freak out version of the oh no, or they actually refuse or say, I'm not going to try it, I'm not going to do it, I'm not going to go. And we're going to talk a lot about not responding a lot to the first reaction and understanding that it's that anxious response. And we're going to work with kids and parents to cultivate a second reaction. So that's exactly how the language we use with kids. You're having that first reaction. It's not your fault. It's saying everything will be bad and you can't do it, but we're not taking that as your final answer. We help them understand that their first reaction is almost always about the most awful thing that could happen instead of the most likely, so that we want to help them think twice and not trust that first reaction. We'll talk a lot about feelings versus facts, this notion of being in danger versus being afraid. And the other thing is anxiety always takes children to the future. It takes adults there too. And as a parent and as a child, you want to be focusing on the present. This moment, this situation, not way out in the future, not tomorrow, not next week. So we'll talk a lot about helping kids stay in the present. Now on to parents. The anxiety or stress is normal and a part of life. It might be uncomfortable at times, but it's not dangerous. And the parent role is not to prevent, protect, or remove children from anxiety or adversity. The parent role is to try and teach and model how to cope with anxiety as it arises and to persevere under adversity. These are the 2 things that help our children succeed in the world in every aspect: art, music, sports, academia, and just life. Why do parents kind of get in the mix and have trouble with this? The most basic reason is it's just really hard as a parent to see your kids upset or uncomfortable. It tears at the heartstrings. It's just downright difficult. Some parents have experienced anxiety themselves, and they really don't want their children to go through what they've gone through. If parents have not had treatment for their anxiety and they struggle with it, they might come to believe themselves that anxiety is dangerous or detrimental to have. So they have that same belief that their children might have. And this is a little bit harder to understand at the bottom, but it can happen that parents might do for their children, take over in the morning, remove them for the situation because they're maybe less likely to get angry themselves if they deal with the anxiety rather than waiting their children through or taking them through that moment. It's a way to kind of manage. And of course, when you're late and going to work and your kid's not ready to go out to the door, you might just have to do it just to have life work. But we want to talk about that as an overall response. So I'm going to do this very quickly. This is the master plan for anxiety, again, from Dr. Chansky's book. Her language can be helpful, so I'm putting that here, even though I might do something a little different. We want to empathize with what the child is feeling, join them in their concern and their distress. We're going to do some relabeling of the worry. We're going to help get the body on board. I'm not going into that too much tonight about some ways to calm the body. And we want to help them refocus on what they want to do in the moment and to face fears step by step rather than everything all at once. I'm going to skip this in the nature of time. But we want to build competence and mastery The goal is to help children cope with anxiety, not to experience no anxiety, and to be in charge of their life choices, which means facing fears step by step and building a sense of confidence. Exposures or trying things that are scary teach us a few things. That usually anxiety will go away on its own without having to do anything fancy. That bad things are unlikely, very unlikely to occur, not to never occur. So we don't want to ever say that your friend will say yes to your invitation or you'll never be teased because that's just not true. The other thing that is so wonderful to see anxious children do is to accomplish something because they are so proud, either teens or kids, of being able to do it. So how a parent can help with an exposure is to start small and to start with success. You might make a list of the things related to what your child is afraid of. And it's really important to ask the child to tell you what is the least or the most scary for them. Don't assume. I've gotten it wrong so many times when I've been a therapist that I think something is going to be the hardest thing for a kid, and they'll say, no, that's not so bad, this is the hardest. So we might begin with an exposure by making predictions about what's likely to happen and then evaluating the outcome once you're done. So before our child would be trying something, and I'm going to give you some examples, what do you think will happen to your worry when we try blank, to go to a new restaurant that you've never been to before? And then we want to ask them afterwards, what was it like when you tried this? And we want to make this short and simple because I think parents know that if you're beyond 2 or 3 sentences, you usually lose your children or they feel like you're lecturing or nagging. We use a rating scale kind of like this. It can use the numbers 1 to 10 or use a visual to say a situation is not at all scary, 5 being pretty scary, but I can manage, and 10 is a get me out of here situation. One thing that's really important that I hear a lot from parents who have kids who are anxious is they might say, my child is so anxious so much of the time and worries so much of the time, I don't want to stress them out on the weekend by having them do a play date or to try something different. But the hard part to say is those kids actually need more practice than kids who don't have difficulty with that. So kids who don't feel competent or are not so good at situation needs lots of practice. Kids who don't like change need to practice changing. Routines are good, but life throws changes. So we want to build in routines as much as possible because that's what helps adults and kids feel better. But we want to actually deliberately change things up at times so that they can have practice managing it. Being late to a class, being late to get picked up, switching the order of the plan for the weekend. Kids who are not good at play dates need lots of play dates. That doesn't mean you do 4 a week, but you might say every 2 weeks I'm going to work to have a play date for a child who's not so strong at play dates or feels nervous about that. Kids who don't like to try things or things that they're not good at need to learn that skill, to practice being not good. They can try something new in a whole variety of ways, new foods, new activities, new places, new friends. They need practice. Kids who are anxious get a lot of attention for being anxious. And an essential component of what we want to switch is to give kids a lot of attention for being kids and disengage quite a bit from attention for being anxious. So we want parents to help validate their children's experience with anxiety, but at the same time not feed into it. They should have lots of attention for coping, getting busy with what they want to do, breathing, talking back to anxiety, or reclaiming the morning the way they might want it to be. I'm going to give an example of this later. And we're going to help kids know that parents are going to be on the team of the child to make them stronger and to make anxiety weaker. It's very important for parents to step back and think a little bit about the messages they may be sending without even intending to. Doing for or taking over sends messages to your child. An anxious child doubts their competence, even when they are competent. If parents do for me or take over for me, the child comes to believe even my parents don't believe I can do it, or else why would they be doing it for me? We want parents instead to be the holders of the hope of recovery and belief in the child's capability to do it even when the child can't hold on to that in the moment. And we want to help them understand that anxiety might not be comfortable or easy, but it's also not dangerous, unbearable, and it can be managed. I'm going to show you how to do this. Reassurance seeking is a very, very common aspect of all anxiety disorders and anxiety issues. A lot of times kids ask repeated questioning and they think that it makes them feel better. And in some ways they're kind of right. It makes them feel better for the moment that they hear the response from the parent, but then it leads to the next question. So in many ways it keeps anxiety going, even if it feels like it's helping. And I talk to kids just like that. I understand that it feels like it's helping. I'm going to tell you it makes anxiety be central in your mind, and it actually makes it stay around longer. Our goal then is to help the child be able to calm themselves and know what they know. So this is an example of what we might be working on to teaching a child to cope or soothe themselves. We want to teach the child to reassure or talk to themselves rather than the reassurance coming from the parent solely, because we want them to feel capable and competent when they're not with the parent. It's not that parents aren't always there to kind of help provide some of this, but we don't want the child to be reliant solely on the parent doing it to feel better. So checking and asking keeps a child anxious rather than feeling better. So for example, there's many children who every day ask for a plan for the day. And even if the plan is relatively predictable, are you going to be there at 3:30? Will you come to the front of the car line? What's going to happen today? What we would like to say to kids that helps them understand is one question and answer is for you, and the rest is for worry. So a lot of times we'll say, we'll answer that question once, but then I'm not going to answer it again. So rather than answering and rather than punishing the child for asking again, we can ask the child, what is the plan for the day? So if you go over it once, you answer, oh, I'm going to pick you up at 3:30 as usual. If they say, are you going to come, are you coming to come get me? Are you sure you're going to be there for the line? You can say, remind the child what they already know. What's the answer to that question? You know the usual plan. What is it? And a lot of times if there's, again, some predictability to the routine or the week, we will say, I want you to assume the plan is as usual, and I promise to tell you if something is different that you need to know. This can make a huge difference for kids about being able to begin to practice in steps reassuring themselves. The key is avoid avoidance. As parents, we're all trying our best. We want to protect our children from distress, and we want to, at times, then facilitate avoidance. But for anxious kids, avoidance feeds the anxiety, making it more severe and more far-reaching over time. So if mom and dad help me avoid dogs, this must mean dogs are dangerous, mom and dad fear dogs too, or mom and dad think I can't cope. The key to helping anxious kids is to avoid avoidance and to facilitate exposure. So small or simple things that might seem like not a big deal can feed anxiety over time. This example of dogs, there's many parents who cross the street when a dog is barking behind a fence because their child is afraid of dogs. Instead, we'd want them to actually practice walking by the barking dog and know that they can be okay and get used to that. They might ask friends to put their dogs away when they go over for play dates. That's a strange request in some way, to ask a parent to put away a dog who is not dangerous or not harmful in response to a child's fear. So we would want to help the child gradually, step by step, face that fear. So in the moment, for parents, instead of saying, it's all right, you don't have to go, or you can come home early, or you can stay with me here at the party, or come here and giving lots of hugs, or the opposite, don't be scared. There's nothing to be scared of. You always do this, or why do you do this every time? We want to understand and empathize with the child in the moment. So parents can learn to step outside the anxiety rather than be trapped in it with their child. So it might look like this. I'm so sorry this is a hard day. I can see you're upset right now. I know changes are hard for you. Supposedly a child maybe wakes up and knows they're going to have a substitute for school and they're scared about what that's going to mean. You're not in danger. You're simply feeling afraid. Remember, it's your first reaction. This feeling will pass. It's no surprise. It takes you a bit to get used to new things. I know you can handle this. How you feel before the first day is not how you'll feel later. Some examples of ways to talk about it differently. The new goal that we're going to have that's different than what kids want to do is that we want to be okay with being anxious. We want to limit the what if, and we want to help kids come to catch that first what if and stop the process because it winds up really quickly. I think worry is taking over. Let's stop the wind up. One reassurance is to support the child, multiple reassurances, and you're in the middle of the worry cycle. It's important for parents not to necessarily share the goal of having to have all the information, having to be all prepared, and to know everything. We want to actually be okay with uncertainty or not knowing. Of course, this is different from preparation, going to first practice together to check out a new sport, going to visit before the teacher before the school year. This is preparation versus a child who wants you to call and find out and know every detail and know exactly who's going to be there and what's going to happen. Instead, the new language we're going to work on is, I'm not sure, but I bet you can handle whatever happens. Why don't we wait and find out when we get there? We won't know till we go. This is one of our favorites that my colleague Deb Ledley. We won't know till we go. If we could predict the future, life would be pretty boring. Now, this new language is going to make anxious children anxious, but the goal is actually to decrease the anxiety over time and to know that they can be okay with whatever might come. I'm going to finish up. I think I'm getting down to my final few minutes. But a common mistake for parents is to not plan and prepare for what they know always happens. So some parents will fear that if I talk about my child doing the usual freak out before the first meeting, they instead hope it doesn't happen and then get upset or frustrated when it does. And the concern is often that talking about it makes it worse. Instead, kind of being aware that it may happen makes it less likely, and if it does, you have a plan. So it's better to predict and prepare, and it'd be great if there's not a concern, but you know what to do if there isn't. So it might be something like this. You and I know that sometimes when you're trying a new thing, you feel nervous the first day. Let's go over what you would do if you feel nervous tomorrow. It makes it much more less likely they're going to be nervous tomorrow, and you have some idea of a plan. I'm going to just go ahead to give a model of what that might look like. This is a child, again, who had the fear of first activities or trying new things. He did like this, oh no, don't go response, so he kind of said, it's my oh no, don't go. It's that first day feeling. He started to remind himself, I'm good once I get started. And for him, he was going to a new camp setting. Remind we have a plan for who to meet and what to do. The parent coaching in the morning before, because he would talk and say he wasn't going to go and cry for the 45 minutes before they were leaving. If he said, I don't want to go, the parent would say once, this is the plan for the week. This is what we're doing. And after that, no response. The parent was offered to talk about anything except not going. I'll talk to you about anything in the world except not going. And this child often used a go-to response that he's not going to know anyone or he doesn't know anyone. In this case, he knew some kids, and so we just kind of said, you and I both know that that statement's not true. So that'd be an example of kind of helping a kid in that moment. I think I am close to out of time. Is that right, Kateria?
Yes, you're just about done. If you have another last thought, and maybe we'll be able to integrate some of your ideas in answering some of the questions we have from our participants.
Yeah, so I think I'll just do this last slide. Validating your child's experience does not mean you agree with the child's solution. So it really is fine and helpful to say, I'm so sorry that this is a tough morning today. That doesn't mean they're staying home. Sometimes kids are not going to thank you at first for doing this. They might even bring out the parents don't care. But what we find is in a few days or a week later, they are actually much happier about how they're handling a situation, and that parents can know that they're caring in a different way because they're helping their child step out of that cage of fear. And it's really okay for parents to say, we have to do mornings differently or night times differently because I need my sleep, or I need to get to work on time, or your brother is getting late because you're having trouble with anxiety. And we want to help families and kids reclaim their time for themselves from worry. I want to be with you, not with worry. This is our time together to enjoy. So I think I'm going to stop there and take a breather and look at a little bit of questions. And
Okay.
feel free to, at the end of here, now add additional questions if you have them.
Okay, thank you. Thank you, Dr. Siqueland. So I have a couple of questions here about sleep. One question is, how common, regarding what are the age-appropriate sleeping habits, how common is it for young kids to come to their parents' room at night, having a hard time sleeping alone, and when is that part of a larger problem involving anxiety?
That's an extremely good question. Sleep issues are extremely common in anxiety disorders, and it's really important when we're helping families figure out about sleep, about what is the issue. So if a child is separation anxious and they can't be on another floor from the parent during the day, they're not going to be able to be alone at night. So in those situations, we may really help kids handle separation problems in the daytime and then work up to night. There is often the common fear of intruders, or I heard a noise, and we want to help kids be able to soothe. We often have families that might come to us who have a family bed, and they're happy with it. They like it. They enjoy the time together. A lot of children can sleep alone from very, very early ages. There's some temperament issues involved in this, but toddlers and preschoolers often are very fine about kind of going to sleep on their own. We have the nighttime routine and walk them through. We have kids staying with their parents and sleeping in their room all the way up to teenage years because of anxiety at times. But all kids can learn to put themselves to sleep, but it's a skill. And if you have a child who has never gone to sleep without your presence or without your body next to them, say if you lie next to them, they're going to need to learn to do that. It doesn't take long, but it's a skill set that has to develop. Also, some worriers have a hard time turning off their brain at night, so we're actually helping them disengage from the worries because that's getting in the way of their sleep.
Okay, that's really great. And I wonder if there's another question here about the use of the term anxiety. Do you actually use the term anxiety with children, or is it better to say worry?
I have found it fascinating that a lot of kids actually use the words in idiosyncratic or their own ways. So with younger kids, I use scared. They don't understand stress, so they don't understand anxiety. Teenage boys or middle school boys, they respond to stress better than anxiety. So I might say, do you get stressed out? It seems easier to be able to say that you get stressed than other. But other kids will say to me, I'm not scared of that, I'm anxious about that, or I'm not anxious about that, I'm scared of that. And I ask them what they mean. So sometimes they mean they have that just kind of overall anxious feeling. Then they call that anxiety, and they call scared if they're thinking about something specific. So I would go with the word that your child likes the most, and I have had kids prefer to use anxiety at times, and other kids who prefer those other alternatives, scared and stressed.
Okay. So very much tailor it to your child's personality and what they feel comfortable with.
And listen to what they say. Listen to how they describe what they're feeling.
Okay, great. Another wonderful question. What are some soothing techniques for older teens?
That's something that we cover a lot. It's really important to know that there's always talk about breathing. And I was saying that about 75% of kids who come into my office, especially the teenagers, said if one more person tells me to breathe, I'm going to kill them. They get really tired of, because that's what everyone says. Teachers say, parents say. So if they have that attitude about breathing, breathing is not going to work for them. What I love for teenagers is there's a ton of apps, and the ADAA has had some reviews of them online that actually you can click a button and it has relaxation, mindfulness, visualization techniques. One that's free, that I shouldn't advertise too much, but it's a research-based one, is called Mind Shift. It's really good for teenagers, and it's a free app. But again, ADA reviews them. But one thing to know is relaxation doesn't have to be breathing, and it doesn't have to be being quiet. Whatever kind of engages a child, so journaling, drawing, yoga, and many kids actually need to release their anxiety by being active, and they might do best to do 10 push-ups, right? Or 10 jumping jacks. They can kind of release it that way. So you can ask kids about that. Do you need to get still when you're anxious, or do you actually need to kind of move to release? But more and more teenagers are open to mindfulness, yoga, and as I said, other activities that just engage their brain and get them in the flow. So I think there's a lot of opportunities for adolescents, but you really need to say to them, here's some options, try them out and tell me what you think, because they really need to find their own.
Right. I think that's a very important point. Sometimes you just have to try, see which technique works best for you. Sometimes you just want to get the energy out and still, find some stillness through a lot of energy and finally releasing. And then other times it's more of through more relaxation, kind of the traditional relaxation piece.
I will tell you that I've been constantly surprised, and I tell therapists, especially trying to do this, that I have had more teenage middle school boys really love relaxation of all the people. They like the concreteness of it, a body scan or muscle relaxation. And I always say to them, try it and see. But they are the ones most likely to be receptive to it. They like to have a script to listen to. They like to have something to do. And again, amazing resources that you can just go to Amazon or Google to look at things to try, and they can listen online and see what they like. So that I've had a lot of teenage boys love relaxation, breathing, muscle relaxation as their preferred way.
That's wonderful.
Yeah.
We have another question about when should a parent consider medication?
Well, I think that's a really good question. There's some very good research that you can go look at about what's helpful for anxiety. There's been some multi-site clinical trials with hundreds of children that have compared medicine, cognitive behavioral therapy, which we're talking about, or their combination. They both work. The general guidelines is that since so many children respond to the cognitive behavioral strategies, our general rule of thumb is to try that for 4 to 6 or 6 to 8 sessions. And if a child is not making progress or is too depressed to actually do the strategies, we would consider adding medication after a trial of therapy. The truth is a lot of families cannot necessarily find trained providers in their area. So if there's a time that there really is not the resources, money for therapy, or you can't find a therapist through the ADAA.org, that has your specialty. Sometimes medication is a helpful, and it does work with a big percentage of kids. But what we normally do is, as I said, it is to try the therapy, and if we're either not seeing progress or the child is too stressed to be capable of using the strategies, that's when medication happens. In my practice, about 2/3 are not on meds and about 1/3 are.
Mm-hmm. Okay. Another question has to do with incorporating rewards in point system. How do you have recommendations how to incorporate rewards in point system?
Yes, we routinely use rewards for trying new and challenging things. So if we're doing a new thing about sleep or trying to manage anxiety in a different way, we'll do rewards, or I'll suggest rewards for the first number of days of starting something. So rewards for initiating, increasing motivation are wonderful and incredibly helpful. But I also say to the kids before we start, we're going to give a reward for trying this new and difficult thing, but you're not going to be getting rewards for continuing it. So for new challenges in the beginning, I also want to have parents think, sometimes it happens that parents will say, I'll get you this game if you sleep in your bed 2 nights. Behaviors like sleeping take 3 weeks or more to happen, so I will not, give any kind of big reward in general. I don't give big rewards, but I would really, if we were trying to work on sleeping on your own, the reward may come after you've done that for a month. But in the meantime, in a day-to-day way, you might get extra computer time. We might go to Five Below, at the end of the week if you stay, follow our plan for 4 out of 5 nights. But I do that level reward, a special dessert, time to stay up a little bit later, computer time, and then if it matters, to kind of work towards a reasonable, not too expensive reward, and one that a parent can easily provide without having to rush to, Toys R Us or to go online and order. You want to have something available and easy for a parent to do, so they're not stressed providing the reward. But rewards can be great.
Right, that's a very important point in trying to really pick the appropriate size and the timing of it all.
Right. Yeah. For a teenager, it might be saving towards a gift certificate, for Amazon, that they might, get, $5 a week or something towards a $20 gift certificate. Teenagers are harder. My experience, I'm not sure about yours, Kataraya, a lot of teenagers don't want to be rewarded for addressing their anxiety. Some really do, and it still helps. But a lot of them just say, I want to feel better, and I don't want to, have this get in my way, and they actually don't want rewards. So some teenagers, it does really help. The younger children need the kind of more immediate, a sticker each day, like a 4 to 8 or 9-year-old needs something pretty quickly, even if it's small, and then maybe they could trade it in for going to ice cream with their parents at the end of the week, or something like that. But they need the more immediate.
Very important point. Now, 2 additional questions that are somewhat related. One is more about recovery. Can a child recover fully from being anxious, or is it likely they will grow up to have other problems, other anxiety problems?
Oh, no, I don't think it's necessary that would be true. I mean, untreated, I think there's a bigger risk that they would struggle with that for a long time. However, treated, I think our hope is that we don't remove anxiety. For some kids, it actually just really goes away and they're handling it. But for most, it's that it doesn't bother them, it doesn't distress them, or it doesn't interfere because they know what to do when it arises. And so I think the goal is, like I said, is to honor one's temperament but not be ruled by it. So kids might always be one who takes a bit longer to get used to a new school year, right? Or who have that first reaction, to a change or something. But that doesn't have to be a problem in and of itself. So I guess that's my version of recovery. I say to some kids, And parents, that a lot of kids will worry hardly at all, and they might have no worries for a few years and then hit another transition or another difficult time, and then it arises again. There's lots of families and kids who do not come back for issues, but other kids more to say is, I might still worry, but I don't care so much. It doesn't bother me so much, and it doesn't undo me. And I think that's what we're aiming for, is to know yourself, know what it is, and to know that it doesn't have to get in your way.
I think we have maybe time for just one or two more questions. And one, I think is one that has come up in the past, certainly for me as well, is what do you do when a child refuses to engage in treatment?
Well, I do think there are options. I'm a family-oriented therapist, so at least for me, and I think for many other good child therapists, they know that this can happen. So I currently have one child who has come to 3 sessions. Well, actually didn't come to 1 session, sat in the waiting room in another, but hasn't spoken or participated with us. And yet we're still going through with family goals and guidance, and we're saying that she's about 12. We really hope that you're part of the process, but we're going to be going ahead with addressing some of these concerns because we need it to be different for the family. And that I think a lot of parents can seek guidance about how to kind of coach their children through these moments, how to change their family environment and their reaction, and it usually invokes change in the child. We don't need the child to participate to evoke change. It's always better. It's always what we try and do. But sometimes actually if things start to change, they decide that they actually want to be part of the planning because things are being planned around them.
Right.
So my experience as a family therapist, especially for teenagers, they hate that they're being talked about and plans are being made for them without them, and that if I do 3, 4, 5 sessions with the parents and we start to do things, they almost always come in. So I it's not always the case, but I think there is a strange sense that we have to wait till my child is ready. That's fine if the anxiety is only impacting the child and they're managing okay. But if it's impacting the family as a whole, their functioning, their enjoyment, their ability to travel, their weekends, then I think that it's important that the family say we need to do this for us. And I think I just always want to support parents to feel like they have the right to sleep better, right, to, as I said, to be able to do things freely as well, even if their child is anxious.
Okay.
So that's my easy answer.
Thank you. One last question is, how do you incorporate siblings if there's one child who suffers more and a sibling doesn't seem to have much of an anxiety problem? How are they folded into the plan?
I actually, myself in my practice, only involve them if it's relevant. I have had siblings come in who feel like the anxiety of their sibling has actually either worried them, impacted them, led to favoritism, or too much attention. And so I have met briefly with siblings, to address their needs and to help them speak with their parents about that. But I don't generally involve the siblings unless they're directly distressed, upset, need information, or if they're bullying or teasing, the anxious child, I might bring them in so I can explain about the nature of anxiety and hear what's going on for them and try and address that issue, which does happen at times.
Okay, I think that's just about all the time we have. Thank you, Dr. Siqueland, and thank you, everybody, for attending this webinar. You'll receive an email to let you know when the recording of the webinar will be posted on the ADAA website. We hope this was helpful. Please let others know about this series and consider making a contribution to ADAA. Thank you again.